I'm Anna Buckaloo, president of the chamber in Montgomery and the River Region, and so excited to have with us this morning Senator Doug Jones. Senator, these are certainly trying times for our nation, and your leadership is so much appreciated by our community. And while we're getting Senator Jones's audio set up, let me tell you a little bit about Senator Jones. He is certainly a pleasure for us to work with at the chamber. Senator, we always love working with your staff.
I'm good.
There you are. Good morning.
Good morning, and thanks for having me. I am still somewhat technologically impaired when it comes to these Zoom meetings and all the calls that we're making these days. So thank you. But I want to take a few minutes and give everybody kind of some updates on where things are, what we've done, the issues that we've seen, and maybe some of the problems that we've encountered, what we're trying to address, and what I see happening going forward in the next few weeks, at least from a congressional standpoint. So I hope everybody in Montgomery and on this call is doing well, that you have followed the governor's advice and orders and the advice of all the health professionals to stay at home as much as you can, to social distance as much as you can, but that's because at the end of the day, that is still, and I think this is important for everyone to remember as we try to figure out the right way to go forward to open Alabama and this country back open. We've got to remember that the only tool that we have to fight this virus, the only tool right now is social distancing and hygiene. That is the only tool. There is no real treatment. There is no vaccine. A vaccine is 12 to 18 months away. So the only tool that we have in the toolbox, and it's an efficient one, as I think we're seeing not only in this country and the state, but around the world, is social distancing until we can get that vaccine and get it widely distributed. From a congressional standpoint, we have passed 3 bills. The first bill dealt with emergency relief to try to get equipment, testing, and those kind of things. This was an $8.3 billion bill that we passed fairly early to try to make sure that people were getting prepared. Unfortunately, that was not going to be enough. We knew it was not going to be enough. It was something that got hammered out in about 2 days to immediately get some relief. And it had some effect, but obviously the second bill was a bigger bill. It dealt a lot with nutrition programs for children, for single parents, and for the elderly. We also did in that package to the paid family leave so that people that were infected could take some time off for themselves to care for a loved one. And there were a couple of other things that we did. That was a fairly robust package, but the big one was what have called COVID-3. That's the $2 trillion package. And that came together fairly quickly, but unfortunately not as quickly as the devastation that was being taken by this virus. To give you a perspective, and I hope that health professionals, you've been listening to these health professionals about this particular virus. It's not like SARS that was relatively isolated. It's not like MERS. It's not like H1N1. It moves very rapidly and spreads very rapidly and is more deadly and the symptoms are incredibly bad for a lot of people, and is more deadly than H1N1 or the regular flu. This is a serious, to give you some perspective. And I like to do this because we see every day the numbers, but we don't always appreciate how rapidly this thing has spread. On March I think it was the 6th, actually March the 7th, it was Saturday. I was at home. The House of Representatives was already working on the second package. And I went up to Gunnersville as part of the Bass Pro, Bassmaster Classic. Coming back, my staff and I were on the phone trying to figure out where we go next, because the United States of America, and this is March the 7th, just about 5 weeks ago, the United States of America had topped 400 cases. We now are topping 700,000. 5 weeks, 700,000 cases. It was a week after that day, on about March 13th, where Alabama saw its first case. So in a month, we now have over 4,000 cases, well over 4,000, and we'll hit 5,000 probably a good chance we may hit 5,000 before the end of the weekend. So you can see how rapidly this thing has spread. You can look at the death toll to see how it is. So that's what we've been dealing with. And because of that, so much of what we did in the $2 trillion package, we overwhelmed the Small Business Administration. We overwhelmed the Treasury. So many programs just got overwhelmed. Unemployment. I was on a call with, the Department of Labor the other day, and they have just been unbelievably swamped with the number of unemployment claims. So the second package that we did, the $2 trillion, provided about $350 billion for small businesses. It provided several $billion for the larger companies like the airlines. It was $133 billion for hospitals, about $100 billion to help make up the deficits because so many hospitals were essentially shutting down and not doing the elective procedures and those things that help keep them afloat financially. There was another $33 billion to deal with this crisis. We had, I think it was $150 billion that would go to state and local governments, but that money, and I think Alabama's getting about $3 billion of that. Of that money, though, the problem with that was that it only could be spent on expenses that were incurred to fight the virus and to deal with the virus. It could not be used, for instance, for resources to backfill resources that state and local governments were not getting. The tax revenue that was not coming in, it couldn't be used to fulfill the fire, police, sanitation, those kind of things. That's a problem that we're looking at. Now, obviously, when you have a program, the Payroll Protection Program and the Emergency Relief Fund, those get overwhelmed pretty quickly. The SBA started issuing guidance, and one of the problems that we saw with the SBA is their guidance would change every day, it seemed like. This was all running through banks. Banks were getting overwhelmed, so the banks did what banks do, and I don't blame them for this. They were giving preferences to customers that they knew that they could move the money rapidly. With their regulations, that made sense, but it also had the secondary problem of so many of our businesses and small businesses in Alabama and elsewhere that did not get their money, that they're still in the queue. So we knew when we passed this $2 trillion package that there was going to have to be more money in that fund, as well as probably the unemployment compensation. The federal government augmented the unemployment in Alabama and across the country by extending it up to 4 months and adding $600 a week so that people really were hopefully not going to lose very much, at least for a period of time. Those problems have been consistent. We've got real problems in the agriculture community. I was on the phone yesterday with our cattlemen. Ag people have gotten bumped off of the SBA programs a lot. They were declared not eligible for the emergency loans that they were needed. It's been a real problem for agriculture, which is an industry that we absolutely needed to continue to thrive during this crisis. Cattlemen in particular have had a problem because their prices per head have gone down considerably, but the prices at the supermarket seem to be going up, and they're not getting that, but somebody is. And I've asked for the Department of Justice and Ag to look into that. Here's what I think may be happening on the horizon, and we can talk about this for a minute, and then I'll just kind of open it up. I wish I had a crystal ball to tell you exactly what will come out of the discussions that are ongoing right now and that will be ongoing for a time. But this is what I believe is going to be coming out of two packages. First of all, I think there is going to be another interim measure. They're calling this like a COVID 3.5. It's really to supplement what we did back at the end of March. I think you're going to see more small business money going to the SBA. They're talking about another $250 billion. But I also think that they're going to try to put in place some program, a language to help tweak that program to make it easier. I think there's going to be some set-asides for smaller businesses, independent contractors, those kind of folks that were getting left out. I think that there is going to be language to put some guardrails on there so that banks or other institutions, non-banking institutions, can distribute this money. We just saw last week that finally the Treasury Secretary approved a couple of institutions, Intuit, PayPal, and I think there's a couple of others in the works. Hopefully some payroll processing companies, which is what I've advocated from the very beginning, to distribute some of this money, which will relieve the pressure on the banks, relieve some of the pressure on the SBA. I think that $250 billion will be there. It could be more, but I think 250 is what I keep hearing. But there hopefully will be some language that will tweak the payroll protection program so that it might go smoother for this next $250 billion. As you know, that program is essentially out of money right now. The other thing that there will be more money for will be more money for hospitals. Every one of our hospitals in Alabama are hemorrhaging money. Even hospitals in areas that have not seen dramatic increases in COVID patients have decided on their own, and I think it was the right thing to do, to stop elective procedures, to stop those things that actually keep them afloat, and do only the necessary healthcare procedures that they needed to, and as well as the COVID patients. So we're trying to help with that. I know UAB and every hospital in that state is going to be losing a ton of money. The other thing that we're working on is state and local governments. I had been pushing from the very beginning in their first package that state and local governments need more than just simply help with extraordinary expenses. They need to help with their payroll as well. They need to help with loans, low interest loans or grants that will help them with their payroll, because even we've had stay-at-home orders, people have been social distancing, but yet their expenses in fire, police, and sanitation still go forward. And we've got to help them just like we're helping businesses and individuals. So we've got that program. The money that is going on, we're kind of monitoring how the $1,200 checks are going out. There's been delays here and delays there. And I keep telling folks, we knew that this was going to happen a little bit. That $2 trillion package is really a remarkable feat that Congress did in a bipartisan way to come together in about a 2-week period for the largest financial package in the history of this country. And we could not let the perfect be the enemy of the good. So there are problems with it. We knew that. We're trying to fix those in the next package. Beyond 3.5, I think you're going to see another bigger package as we see how the country, listening to our healthcare professionals, how the country is going to need to reopen, how Alabama is going to need reopen, the precautions that we're going to be taking. We're not going to be flipping a light switch like we do every year during the holidays on a Christmas tree. This is going to be a series of rolling out, trying to listen to the health professionals, follow the data so that we can do this in a very smart way so that we don't see another rise. Again, remember what I said at the very beginning. The only tool we have to fight this virus, which is still in our country in a big way, which is still in our state in a big way. We're still seeing increases in Alabama right now, according to Dr. Harris. The only tool that we've got to fight it is social distancing. So we've got to be careful, which means the economy opening up is going to roll out on a longer basis. I don't know how long, but we're trying to make plans to address that for businesses and workers. One of the things that you'll see today that I am rolling out with a couple of my colleagues is a Paycheck Security Act. It's a big program. There's no question it's a big program, but we're trying to do something working directly with the Treasury so that businesses and individuals can continue to receive their paychecks up to $90,000 for a period of months, knowing that we hopefully will be able to wind it down with these businesses. But we want to protect people. We don't want anybody having to move to unemployment rolls if we don't have to, because the money is still going to come from the federal government. The other thing you'll see is a lot about testing, not just the testing, the swabs that you see to determine whether you have the virus, but the serology, the serum testing, the blood test that are being developed right now and being approved by FDA. That is going to be very important going forward as we can do contact tracing to try to get control of this virus, to keep people distanced, quarantined when necessary, to try to control the virus going forward. There'll be a good bit of money and a good bit of emphasis in the next package on that. We will still be looking at the businesses. I think we've got to do something more for our agriculture industry. It is the one industry I believe is being really left out of this package or the other package, and we've got to do something for our farmers because they're really hurting really bad. And the last thing I will tell you that I'm doing as far as the healthcare thing, I am working with colleagues in Washington to try to give states like Alabama, who did not expand Medicaid, those 14 states, particularly in the South, the incentives to expand Medicaid. We're looking at a number of ways that we can tweak the bill that I've already got to allow states to potentially expand Medicaid, at least during this national emergency. They can then opt out if they want to, but give states 100% reimbursement for their Medicaid, because that does 2 or 3 things. Number one, it helps over 300. I've heard anywhere from 326,000 up to 377,000 Alabamians get coverage, get healthcare coverage, and allow the federal government to use those dollars while we get people coverage so that we can use the additional healthcare dollars directly to the hospitals. That will help Alabamians. It will put those federal dollars in Alabama's economy. And we're going to see a dramatic increase in Medicaid anyway, as people will lose their jobs. We know that. People are going to lose their jobs, and they're going to end up having to apply for Medicaid anyway. If we can do something in the federal government to expand help states expand during this crisis, give them some incentives to stay on the expansion once the crisis is over. If they want to, if they don't, they could go back. I'm really working hard on that. I think that there is some significant benefits to Alabama. The one thing that this crisis has shown and really put a spotlight on is the disparities in our healthcare across the country, and particularly in the state. But also, we now know that the health of our neighbors is dependent on our health, and our health is dependent on our neighbors' health, unlike anything that has been demonstrated to us in the past. So that's me just rattled off as much as I could in a short period of time, and I'm happy now to try to answer any questions.
I can't tell you how much we appreciate you making time and your leadership in Washington right now. We do have a couple of questions.
Sure.
I appreciate you opening up to questions. One from, and I can actually see who they're coming from, which is kind of nice. Todd Smith out at ASF. Of course, the Shakespeare Festival is such a huge part of our community here and our cultural, establishments that we've got. Todd's asking, when will the additional $250 billion be available to the lenders? I know that's a projection right now, but any thoughts?
Yeah, I don't know, Todd, specifically. I know that there's a lot of discussions. I was on a number of calls yesterday, and I've got a couple scheduled after we finish here. There's a lot of discussions going on. I think the key is trying to figure out how to best tweak the program so that we have the assurances that it's going to go where it was intended. I'm hoping that will get done next week. And as soon as it can get done, we've got to do this in a way, because we're not in session. And this is a challenge for us. We're not in session, so we're doing everything by Zoom and conference call as well. And those discussions, but we've got to get it done and done in a way that we can do this by unanimous consent, which was all 100 senators agreeing to it, all 435 members of the House agreeing to it. There's procedures to do that. So whenever you've got that kind of activity, it takes a little bit to go through all of that to make sure we get the unanimous consent. So I'm hoping next week, but I really think by the next week, I would be very, not just surprised, but incredibly disappointed and somewhat angry if we can't get this done in the next 10 days to 2 weeks at the maximum. I'm hoping it'll be done by next week.
Great. And then another follow-on question to that. Will 501c3s, nonprofit religious organizations be included? And then also, you've probably seen a letter circulating in Congress advocating from chambers of commerce and economic development associations that C6s be also added into that language.
Yep.
Because many of our programs, for the small business community and to help get the economy back on its feet, we too will have that same business interruption, basically. When our cities and local governments lose revenue, generally your chambers of commerce and economic development associations do as well. What are your thoughts on that, sir?
Well, I'm in favor of having the chambers do it. I will say all the others will be included, just as they were the last time. We've got to deal with a number of organizations that were excluded. I'm particularly concerned about agriculture, to be honest with you, because they are really, I think, getting the short end of the stick. And it was not intended by Congress to be that way, but the SBA guidelines, what I call their continuing moving the goalpost, has excluded so many agriculture folks. All of the other 501Cs, the litany of nonprofits and religious organizations will be included in this next package. And if there's more needed, I don't want people to think that the one that I talked about in the next week to 2 weeks is going to be the end, because the other things are going to be included in a much bigger package in May that will, I think, will probably still add more money in some of these same programs. The Chamber of Commerce's, I will tell you, seems to be a little bit harder lift, and I'm not sure exactly why, except that there are tax advantages we're also giving to businesses who are the lifeblood of the organizations to contribute, to encourage contributions to all nonprofits in the chambers. I've been trying to advocate for it. I'm going to continue to do that, but I'll just be honest with you, it seems to be a fairly heavy lift. I don't think chambers will be included in the package in 2 weeks. And what I would encourage is that folks really, your various chambers, maybe get together and send me and Shelby a letter about what you're seeing and the need, and why you just can't rely on the tax breaks and the generosity of your businesses to continue funding going forward, so that we can have in our respective caucuses some really good talking points that we can use.
Oh, that's an excellent idea, Senator. We will do that. Thank you. Thank you for your support on that.
Sure.
Another question from one of our banks in the community, just how quickly the initial funding ran out for the PPP loans, and just your thoughts on, will the $250 billion be enough? Or do you think there could even be a third round of funding?
I think that there will be more funding. I mean, I will be stunned, frankly, if the $250 billion that we're about to put in is going to be enough. And I say that for a lot of reasons. Number one, we saw how quickly 350 went. And, I would not be surprised that some of the businesses that got the initial 350 are going to have to come back to the well at some point. I don't think they would be or should be eligible for any of the 250, but I'm looking at the next package, what we'll call COVID 4. I mean, we had COVID 3 passed, and I hate acronyms, but this is what we do in Congress these days. COVID 3 was the $2 trillion package. 3.5 will be the 250 plus 250 billion for small businesses and some healthcare and state and locals. And then you'll have the next bigger package, which will be COVID 4. I would not be surprised at all if we have to put that back in there for small businesses. But remember, a lot of the small businesses is this payroll protection plan. And one of the things that I would encourage folks to look at, we have not officially done this today, but we're doing it today or this weekend, will be this second program that we're looking at, that I've got with several of my colleagues, that will be the Payroll Security Act, which will help fund payroll and give some paychecks for folks. That's the biggest chunk of all of this. And if we can set a separate program outside of SBA that is just literally going to be grant money. I mean, I just got to be honest with you. The Payroll Protection Plan is essentially a grant, even though it starts out as a loan. That has been part of the backlog, because banks, I know, have had to go through their underwriting for a loan, even though this money is going to be forgiven down the road, assuming that the companies abide by the rules, which I assume they will. And the Fed is also going to be buying some back. It still put the requirements on banks. This program is just going to be a flat out grant with things. And hopefully we will be able to use payroll processing companies. 40% of businesses use payroll processing companies. They've got the infrastructure there. That's what I pushed from the very beginning, which would have made this program a lot easier. But if we have a Payroll Security Act like program like we're rolling out today, it will make it more efficient, I believe. It will continue to be costly. But again, as we continue to slowly roll up the economy and get folks back to work and back into business in a way that is going to continue to protect people, we are going to need to help businesses and those individuals who work for those businesses for a longer period of time. And I think Congress has just got to come to grips with that to make sure that we know, because we can't let, we're going to do what we can to keep these businesses from failing and to keep the employees from losing their houses and everything. That's a whole separate thing I hadn't talked about, was the foreclosure forbearance. There are so many tentacles to this thing. It's incredible. So I do see more money. I do see it lasting for a longer period of time, but we just need to figure out the best and the most efficient ways to do it.
Thank you, Senator. Another question. Do you have any idea when Alabama may be going to open? And I know that would be a conversation between our delegation and Governor Ivey. Do you have any thoughts about, would that possibly be a county by county reopening of our economy, kind of a ramp up, maybe a region by region? Any thoughts on that?
Well, the governor has been working on this, and I am hopeful that they are going to let at least for a period of time, if not for longer, let the healthcare professionals and the health and the data kind of control this. I know the governor has asked each of the members of the House of Representatives, Congress, in their respective 7 congressional districts to help form some advisory groups within their region to try to see what they can do to reopen. Now, one of the problems that we've got in Alabama, like the rest of the country, we have seen a lack of testing. We really don't know all where this virus is. We've seen it in all 67 counties, but if you look around the state, you would think, well, there's certain counties that are in great shape. They don't have a lot, but then look at the next little line to show that they've conducted very, very few tests. So this is going to be a really important thing that has to be carefully thought out and be driven by healthcare data. Every model that I'm seeing right now shows that Alabama is still not at its peak. I saw Dr. Harris yesterday. Alabama's been a little bit more up and down, I think, because of that lack of testing in certain areas. We've seen an incredible spike in Mobile in the last week or so. So we've got to be careful. And I think it's got to be driven by the data. I do think that if we can get testing in all areas of the state, it would not be inappropriate to open up county by county. But you've got to remember, too, people travel in this state. And if the county next door is open up and there's restaurants there, people are going to go and they're going to come back in the other county. And one of my colleagues on a caucus call the other day, just this week, was talking about a friend of his, an elderly friend of his. He and his wife went to the beach, desolated beach. It was still open. They have a house so they could go out there by themselves. That was fine. But about 3 counties over, they had a Sunday dinner at one of their favorite restaurants. They went over there. They got, both of them got COVID-19, and the gentleman passed away 10 days later. We've got to be really careful, folks. And that's all I'm saying. I want to get our economy back up and running. We were doing so well. I want to get it back up and running, but I also don't want to see another spike in this virus, because if we have another spike and we can't do those things going forward and this drags out even longer, we're going to see a lot more problems that are not just virus related. We're already seeing, domestic violence, substance abuse problems. So we've got to get it going, but we've got to get it going in a smart way that's driven by the data, whether it's in a county, whether it's in a region, or whether it's a state by state. We cannot let just our American desire for the American dream and capitalism overshadow the seriousness of this virus.
Thank you, Senator. And I will tell you, we've gotten some feedback, from the Black Belt communities that there is they still have problems with test kits, not having
Yes.
enough access to testing kits, or they've gotten some test kits, but maybe they're not complete.
Right.
We just had one of our local companies here, our Mayor Reed, was working with Hyundai, HMMA, or Hyundai Motor Manufacturing Alabama, who was so generous to bring so many thousands of test kits to the state, and they are trying to do what they can also. So, but there's still not enough.
There's still not enough, and we're trying to develop that. We're trying to get more of those, as well as the serology. And there's still an issue about personal protection equipment in Alabama as well. In some of these rural counties, and I've talked to so many people down there, it's not just the PPE for hospital workers, it's for first responders, because in some of these areas, we've been telling folks that if you get sick, stay at home, try to treat yourself, stay in touch with a doctor, and if you start getting in distress, call someone so that you can get to a doctor or a hospital. But some of the first responders in some of our rural areas don't have the masks, they don't have the gloves, so they're afraid to go. I mean, it's a major, major problem. I think we're doing better getting PPE around the state. We're going to be getting more testing, but I will tell you folks, in all candor, the supply chain for PPE has just not been there. It has been the wild, wild west. And the federal government did not do what it should have done in taking control of the supply chain early on and helping all states across the board. It has been the Hunger Games out there trying to get personal protection equipment. It's getting better, much better, but the lack of equipment and testing has been a huge problem, because the federal government has not, I think, stepped up early enough or often enough or strict enough, including the Defense Production Act, where it is still not being fully utilized.
Yes, sir. And of course, communities are doing what communities do, and we rally together, and we've had, our schools using 3D equipment, trying to print PPE, and some of our local businesses have altered their fabrications to try to help. So, everyone's trying to do what they can, but you're right. The access from the federal level certainly is an issue, and we appreciate you, being an advocate to try to get better structure for that system. One last question, sir. Oh, I'm sorry. Go ahead, Senator.
I was just going to say, folks, there's still, the CDC guidelines are still saying wear a mask when you go out. I wear a mask. I got to tell you, those few times that I've been out of my house in the last month, I have worn a mask. I have thought it important, and I would encourage you business leaders, you political leaders that are on this call, if you go out, wear a mask and some gloves if you had it, but the mask is the most important thing, because there are so many people that are asymptomatic that can spread this disease. And I go out, when I go out, I wear a mask because I want people in my area to see their U.S. Senator taking this serious and wearing a mask. And it doesn't have to be an N95 mask. You can make it. My sister-in-law sent my family masks, homemade masks that she wore, and they're nice. They're, as my wife says, they're cute. So we put them on, when we go out. But that helps. Anything like that, it's helping people that you see. It's giving the message that your health is important to me. It is not stopping you from getting this virus, but it is stopping you from spreading the virus. And so that message to all those people that see you is really important, because you're giving this message that your health is important to me, and I'm trying to protect you in addition to myself.
That's very good advice, Senator. And certainly, I know this week, I have seen, I think people are doing that. People are realizing that, people were reluctant at first to do that, to go to that extreme. But I think a lot of our community is realizing that it makes a difference. And so that's good advice for us at the Chamber. We'll continue to advocate for that with our membership and our leaders. I think we have time for one more question, sir. I know you have a big schedule today, from our County Commissioner, Doug Singleton, who's asking, of all these trillions of dollars, what impact do you think that has long-term on the economy and on the value of the dollar?
Well, I think it's going to have a deflating effect on the dollar, for sure. I mean, look, there's good and bad in this. And the bad, obviously, is it is increasing a deficit that's going to be around for a while. I'm hoping that if we can get through this, and I don't believe this will happen this Congress, because I don't think we're going to be fully out of this enough that we can do it. But I'm hoping that the Congress in the future, of which I still hope to be a part of, will be looking at infrastructure bills in a different way. I'm hoping that the government will, infrastructure puts money into the economy. It returns money dollar for dollar plus some. I want to do a rural broadband program similar to what Franklin Roosevelt did with power. But there is going to be some negative effects. There is no question about that. On the other hand, we would be in a far worse, we would be worse off than we were in the Great Depression had the government not stepped in and pumped $2 trillion into this economy. Think about that. Our military wouldn't have the money to defend us. There would be no businesses. Everybody would be getting foreclosed on. They would have no money to pay groceries, to buy the food. It was a matter of necessity, and it's unfortunate. And it was not. This was not a making like the 2008 recession, where you can point the fingers at a lot of folks that were acting irresponsibly. This was a virus unlike the world has ever seen. I say unlike. It was nothing like. The world had never seen this virus before. There were no immunities that any human being on this planet had to this virus. And we're hopefully building those up now. So it's a great question and a big concern for sure. But at the end of the day, had $2 trillion not been pumped into this economy, we would be in a serious problem that leaves ourselves vulnerable to other foreign nationals who really want to do us harm. And so we had to put the house that was on fire, we had to put it out, or at least control it for a little bit. And I'm hoping that once we can do this, we can figure out ways to then come back and start pumping money into this economy and do it in a way that's smart and do it in a way that we can get people working, because people are going to lose their jobs. There are going to be businesses that will not be able to come back after we start opening this economy up. So we're going to need these infrastructure bills. We're going to need those kind of things to get people working again, to get them into different industries and things. So there's a lot of that folks are looking beyond this that we've got to start considering. But I think whenever you have the largest financial package, $2 trillion, that is, to put it in perspective, our discretionary appropriations that Senator Shelby and Senator Leahy put on the Senate floor last year was $1.3 trillion. This was greater than that. And when you have 96 United States senators in such a partisan the world that we're living in, 96 senators vote for it, and we would have had 100, but for the fact that 4 were quarantined, and you saw it pass the House of Representatives so overwhelmingly, you knew there were a lot of people that were just basically holding their nose on a lot of programs, biting their tongue on a lot more, but it had to be done. And I think that I think we're still going to see some more of that, by the way, coming down the road as we slowly ramp up. So thank you all. Thank you. I've really enjoyed this. I really appreciate it. I would encourage you, 2 things. Let me end on. We have a resource page, which is at jones.senate.gov/coronavirus. We have links to a lot of things. We try to update it as much as possible. Please go on there. If you've got questions, you can contact us. We can get our newsletter at jones.senate.gov. We're trying to push information out as much as possible. We try to be a resource for you, and we try to get questions. But also, if you are having problems and you're seeing some things that you think needs to be considered in these next packages for Congress, please let the staff know. I've got a great group there in Montgomery with Sandra, Ron Sparks, and Sandra. They're all there to help. We've got the office in DC. We're all working remotely, but I can tell you we're working our tails off daylight till dark, trying to make sure we help the American people and help folks like you in Alabama. So thank you very, very much for allowing me to be here today.
Thank you, Senator. And we do, we appreciate you and your staff so much. We work so closely with Ron and Sandra here in Montgomery, and we'll share their information with our audience and our membership this morning, because I know you want as much feedback and provide assistance as you can. Senator, I know you usually are so accessible, and you have donuts with Doug in your office where you urge your constituents to come by and have a cup of coffee and a donut. And so we look forward to the time when we can do that again, sir.
Absolutely.
Thank you so much.
Thank you. Thanks, guys. Thanks so much.